Next witness, please.
Shri Hotmire, if I said that right.
You want to come up, ma'am? Raise your right hand, please. You do solemnly swear the evidence of the testimony given in this cause will be the truth, self you got. You have a seat right over here. Adjust that microphone, make it comfortable. Speak up so everybody can hear you, please. You may proceed.
Good morning.
Morning.
Would you tell the jury who you are?
Hi, my name is Dr. Shri Hotmire. I'm from Uvalde.
And Dr. Hotmire, where do you work in Uvalde?
Currently, I work at Uvalde Medical Surgical Associates, which is an outpatient clinic that's adjoined to the hospital.
And when you say adjoined to the hospital, does that just mean you have a business relationship, or is it also physically adjoined to the hospital?
The building is right next to the main hospital. It's also owned by the hospital.
And tell us what your credentials are.
I'm a doctor of osteopathic medicine, which is essentially, there's allopathic and osteopathic. We do the, same training, but we do a little bit more in musculoskeletal.
In what?
Musculoskeletal.
Muscular and skeletal?
Mm-hmm.
Okay. And when did you get your education?
I completed medical school in 2011, from 2007 to 2011.
And after medical school, what did you do?
Then I went to residency at Christus Santa Rosa in San Antonio, family medicine residency program.
How long is that residency program?
That was an additional 3 years.
And after the residency, then what?
And then I graduated in 2014, and I moved out to Uvalde and began working, and I've been there ever since.
Ever since 2014?
2014, yep.
And so, May 24th, 2022, what were you doing on that day?
I was working at the time I was working at a different clinic, which was right down the road from the hospital. And we had just finished morning clinic, and we were in a meeting.
A meeting with other doctors?
Yes, with the staff at the clinic.
A business meeting?
Business meeting.
And about what time was this?
Started around 11:15.
Okay. And did you end up going to the hospital that day?
Yes, I did.
How did you end up at the hospital?
We had an alert that sent a mass text message to all the physicians saying that they needed us immediately in the emergency room.
When you say all physicians, I don't understand what the mass texting is. How did that work?
It was sent out by, I can't tell you I know the exact texting service or anything like that, but it's a messaging service that sends a text message to physicians, and basically was just asking them all to come immediately to the emergency room. That there was a trauma.
A need there?
An immediate need.
Okay.
Mm-hmm.
So you weren't actually in the hospital, but a text went out to all physicians to come?
Yes.
And did you go?
Yes.
And did other physicians go?
Yes.
And on that afternoon, then, tell us how you spent your time.
I got there, I can't tell you exactly the time I got there, but I got there as soon as I could, and it was probably right around noon. And when I got there, I'm sorry, I don't quote me on that. I apologize. I don't know what time I got there. I got there as soon as I could. But when I got there, there were other doctors that were already treating patients, and I circled around in the emergency room and tried to help in any way that I could.
And so this is the emergency room where you see doctors treating patients?
Yes.
About how many doctors did you see working?
There were probably about 8 to 10 of us.
And patients?
Mm-hmm.
Can you tell us about how many patients you saw?
There were 15, I believe.
Okay. And did you treat any of the patients?
I did. I treated. I helped and assisted in some of the ones that were already ongoing and needed just like a little bit of help here and there. And then when those ones were stabilized, I went to a different area where children were waiting that were not as critical but still needed medical care.
So there is an order in which you treat patients when they come in?
Yes.
And describe that for us.
And call it triage, and basically those patients that are the most critical get the most immediate care. The ones that need to be stabilized, it's all hands on deck, and we do everything we can to get that patient better. The ones that are less acute, those ones typically will then be next in line, and then the ones that are least acute will then be seen after the other ones.
And is that the way the procedure went that afternoon?
Yes.
Okay. Now, you said that you actually did treat some of the children yourself,
Mm-hmm.
but other doctors treated children too.
Yes.
And let me ask you then, are you familiar with the records
Yes.
of the Uvalde Hospital?
Yes, sir.
And is it common for doctors to review the records of other doctors?
If asked, we will do that.
I mean, you can read a medical record whether you created it or a fellow doctor did.
Yes, correct. Absolutely.
And I believe at the defense's agreement, they've agreed to allow you, rather than having eight or nine doctors come in, to testify to the records.
Yes, that's correct. This witness can testify to all the injuries to the kids and all the treatment that was done by all the doctors.
Okay, you can proceed.
And so have you done the time, you've spent the time to look at the records of those children that were treated at Uvalde Medical Hospital that day?
Yes, sir.
And are you familiar enough, and have you summarized it so that you can tell us the name of the child as well as any injuries they sustained and the nature of that injury?
Yes, sir.
And you have summarized that for us?
Yes, I have them here. If you don't mind me using my notes.
And we may not be in the same order, so it may take
Okay.
a second for you to find it.
Okay.
But if we could start with Exhibit 910. Mia Cerrillo. Could you tell us what injuries Mia Cerrillo sustained?
From the summary on the medical record, she had pretty significant shrapnel injuries.
And what is shrapnel injury?
Shrapnel is basically little parts of or fragments of bullets. Fragments of bullets that get embedded in the skin or other locations.
And was there a location in which she had the shrapnel?
Yes, sir. She had fairly significant shrapnel to her thorax, which is basically the back and the chest area, in the left flank, and then on her left shoulder.
And when you see shrapnel in somebody, do you remove that shrapnel?
If it's superficial enough, then yes. Otherwise, it can work its way out. Sometimes it, may need to be surgically removed if it's symptomatic, if it's causing pain or causing nerve impingement.
So with all of these shrapnel wounds, the issue is if it's superficial, it can be removed?
Yes.
And if it's deeper, why would you not remove it?
Just have to weigh if it's doing more harm than good, then you would definitely want to remove it. I mean,
Shrapnel.
sorry, not good. It's not going to do good. Excuse me. If it's not causing symptoms, then it's something that could potentially be left in.
Because going in could cause harm too.
Yes, absolutely. It could cause, pinching of nerves. It could cause pain, pain with movement.
And the nature, because it was shrapnel, do you have an opinion as to whether or not this was a gunshot wound?
I think it's definitely a gunshot wound.
Thank you.
This patient was treated by a different physician.
Thank you. 905. Could you tell us what injuries
AJ Martinez, he had a gunshot wound to his right thigh with significant shrapnel to the right thigh, as well as some shrapnel injuries to the left side of his head and his face.
And what is the right femur?
The femur is the long, big bone on the top part of the leg, right here.
And so was this shrapnel penetrating shrapnel or superficial?
Was the shrapnel?
Did it penetrate or was it on the superficial?
It was close to the femur, and it had multiple shrapnel injuries in the subcutaneous, which is basically the layer below the skin, and in the deep soft tissue, which is
deep soft tissue.
Mm-hmm.
Thank you. Exhibit 906.
Significant right ankle injury from shrapnel foreign bodies. He had several pieces of shrapnel embedded in his right ankle, and some of them were large, up to 10 millimeters, which is 1 centimeter, about a little bit less than half an inch. But thinking about that being embedded in soft tissue, that is fairly large. And then one of them was close to the Achilles tendon, which is the large tendon in the back of the lower leg where the calf attaches to the heel.
Kendall Oliver.
To her left shoulder, she had a very large soft tissue defect, fracture of her humerus, which is the bone in the upper part of the arm, significant shrapnel to the left shoulder, and then across the front of her abdomen she had quite a bit of shrapnel as well. Shoulder. He had an actual gunshot wound. It was described on the CAT scan as a massive soft tissue defect containing multiple bullet fragments of the right shoulder, and then of course multiple shrapnel pieces in that area as well.
And what does massive?
So this exit wound was described as 4 centimeters by 4 centimeters, which is about 1.5 inches. In such a small anatomic area for a child. That's he had shrapnel injuries to his right thigh. So on the lateral part of his right thigh. This girl, she had shrapnel to her left thigh and also to the left side of her face along the frontal bone and then around this area of her scalp,
And where is her frontal bone?
right here on the forehead. On the forehead.
And there was shrapnel there.
Yes.
Maya Zamora?
When she arrived, she was scared, anxious. She wasn't talking. She was already receiving fluids from EMS because her blood pressure was low. She was found to have a gunshot wound to the left side of her chest, which was a sucking chest wound, which is basically air is going in but it's not coming out, which then caused both lungs to collapse. She had a very, very large gunshot wound to the left shoulder, the left arm, and then the right hand. The ER physician that was taking care of that trauma bay, he had to do needle decompression, which is done in emergent situations to let that air out, allow the lung to expand, and then he had to put in bilateral chest tubes to continue to allow the lung to reach the pleura, which is the lining of the lung cavity. He gave fluids, crash blood, and then this patient was one of the ones that was transferred out to a trauma center.
When you say transferred out to a trauma center, tell us what that is.
BAMC is typically where we'll transfer to, university, a higher level of care that has a trauma surgeon available.
Okay.
Reported that he had a bullet go past his thumb and then it created significant ringing in his ears.
Okay.
Yeah.
And Jordan Olivares, 97.
He reported that when he was running from the active shooter, he hit his lower leg on an object, and he had a big bruise on his lower leg.
Dr. Hotmire, my name is Jason Goss. I'm one of the lawyers representing Green. I just want to say, I know that you would just say it's doing your job, but we appreciate that you did that, help those kids. I don't have any other questions.
Anything, redirect?
No, Your Honor.
Excuse, not subject to recall?
Yes, Your Honor. No, no recall.
Okay, Doctor, you are excused. The rule's been invoked, so we would appreciate it if you just wouldn't discuss the case with anybody until you're aware the trial's over with.
Yes, sir.
Thank you very much.
Thank you.
I'll tell you what, ladies and gentlemen, let's take our morning recess. Take about 10 minutes. Please remember my instructions. Would everyone please rise for the jury?